Hello everyone, I am Dr. Amit Bhushan Sharma, Associate Director and Unit Head Cardiology, Paras Group of Hospitals. Today I am going to talk about resumption of exercise after resolution of COVID infection. Many times, once the COVID is resolved, people ask, should we start exercising? When should we resume our regular physical activity? When should we start working? So till now, with our 9 months of data, we were not clear about when should you resume our physical activities, and suddenly we had some spurts of sudden cardiac arrest or sudden collapse while the patient was exercising after COVID. So then the American Association of Physicians has come with the following guideline. There is mild COVID, there is moderate, and there is severe COVID. Mild COVID means if your symptoms were there for less than 1 week without any multi-organ damage. Moderate COVID means if your symptoms or a fever was there for more than 1 week. And severe COVID means that your symptoms were there for more than 1 week. Along with that, you had involvement of multi-system involvement. That means you had cough, cold at the same time, and you had abdominal pain, loose motions, increased liver enzymes, or multi-organ damage which was there, or your cardiac involvement was there. So in such cases, that is severe COVID. So guidelines are very clear now. If it is a mild COVID, then you need to go to your physician. He will perform a general physical examination. He will be doing a 14-point examination, which is mandatory. And then if he is clear from that, and he'll ask you particular questions pertaining to your cardiovascular history. If you are clear, then you can resume exercise immediately after 10 days of resolution of COVID. If it was a moderate COVID, then in addition to the general physical examination, you also need an ECG, an echocardiogram to see whether you are exercise fit or not. And in certain cases, you might require a treadmill testing or an exercise stress test to see whether your heart rate has picked up, your heart health is okay or not post-COVID, because we are seeing delayed symptoms of COVID myocarditis or COVID involving the heart at a later stage. The third subgroup is tricky. If you have a severe COVID infection with multi-organ failure, in that case is minimum 3 months before you resume physical activity. And before you resume physical activity, you should at least get a stress echo done to see whether the damage of the heart is not there, along with a routine chest X-ray, along with certain enzymes and certain blood tests, including IL-6, D-dimer levels, CRP levels, just to make sure that there are no inflammatory cytokines left in the body which can cause further damage to the heart or lungs. Thank you so much.